moment. Thank you so much.
Thank you, Mallory. Good morning. Today is Wednesday, September 18, 2024. It is 11 a.m. Central Time. Welcome to the second web briefing of the Iowa Advisory Committee to the U.S. Commission on Civil Rights. My name is Juan Garcia, chair of the committee, and I will be chairing today's web briefing. I will now conduct roll call for members present. Committee members, if you are joining by phone, please press *6 to unmute yourself and *6 to place yourself back on mute until I call on you during the Q&A session. I am your chair and I am here. Kyle Bergeson. Paul Fessler. Katie Fiala. Adam Freed.
I am here.
Cynthia Culver. Stephanie Musterman. Alan Ostergren. And Donald Roth.
I am here.
Thank you, Donald. We have a quorum present, and I will proceed with the meeting. Also present are commission staff. The U.S. Commission on Civil Rights is an independent, bipartisan agency of the federal government charged with studying discrimination or denial of equal protection of the laws because of race, color, religion, sex, age, disability, or national origin, or in the administration of justice. In each of the 50 states, the District of Columbia, and the American territories, an advisory committee to the commission has been established, and they're made up of bipartisan persons who serve without compensation to advise the commission on relevant information concerning their respective geographic jurisdiction. Today is the fourth in a series of web hearings examining access to mental and behavioral health care for K-12 students. These meetings will help the committee understand the current issues in accessing mental health care for K-12 students and the civil rights implications, if any. Based on information collected through the testimony, the committee will draft a report that will include findings and recommendations that will be shared with the U.S. Commission on Civil Rights. The commission will then forward those recommendations to the appropriate federal and state entities. I'd like to share that at the outset, this meeting is being recorded for the public record, and the web hearing recording will be available on our public database. Please contact, and I'm going to spell it, mtrachtenberg at usccr.gov if you wish to obtain those records or if you would like to receive notification of future meetings. In a moment, I will invite our speakers to present for approximately 10 minutes. After, advisory committee members will have an opportunity to ask questions. This Q&A session is reserved for committee members only. After the committee Q&A, there will be a public comment period where members of the public will be given an opportunity to share their perspective and opinions on the topic. If you're not able to share your full remarks today, please email your remarks to, again, mtrachtenberg at usccr.gov for inclusion in the committee's proceedings. After public comment, the committee will then move into conducting committee business related to planning future briefings. If you're a panelist or a member of the public, you may leave or choose to stay on the call if you wish, as all of the advisory committee meetings are open to the public. Before we move into the presentation, I want to remind everyone again that this meeting is being recorded and will be transcribed for the public record. I ask that you please state your name when speaking to assist with the transcription. Closed captions are available for today's meeting. To view closed captions, click the CC icon on the lower left corner of your screen. Though some of the statements made today might vary from personal perspectives, we want to ensure that all invited guests feel welcome and do not defame or degrade any person or any organization. As the chair of today's meeting, I reserve the privilege to cut short any statements that defame, degrade, or do not pertain to the issue at hand. Any persons or organizations that feel defamed or degraded by statements made in these proceedings may respond and submit written statements for inclusion in the proceedings. I urge all persons making presentations to be judicious in their statements and remain on topic. The Iowa Advisory Committee appreciates the willingness of all participants to share their views and experiences with this committee. Today, we will hear from two speakers with unique perspectives in their respective fields on this topic. Presenters, please aim to stay within your allotted speaking time and reserve additional talking points for Q&A in case you're not able to address them within that time. With that said, let's begin today's meeting. We will hear first from Debra Carr, Student Services Coordinator for Des Moines Public Schools. However, Debra is speaking in a personal capacity. And also, Katie Issa, Behavioral Health Services Coordinator for Des Moines Public Schools. At this time, I would like to invite Debra Carr to please begin. Debra?
Good morning, Commission, and thank you for this prestigious honor to speak with you before you today. I am Debra Carr, a licensed master social worker, and also recognized by the Academy as Certified Social Workers and a Certified Financial Social Worker. I've been working with students and families for over the past 30 years, and I feel very honored to be in this space to share a little bit of my expertise and experience in supporting students and families as they attempt to access behavioral and mental health services in our state. I'm a native Iowan and born and raised in Northeast Iowa, and have worked with various school communities with nonprofit organizations and also inside the schools. And some of the things that we're seeing is a growing number of our children, 1 in 5 children, are experiencing some type of mental health problem during their school years. Examples include a large number of students reporting stress, anxiety, family problems, alcohol and substance abuse, and other serious types of mental health issues that many are struggling to identify supportive services and ways to help them navigate all of these types of issues that they are experiencing through all levels of our school experience. Some of the things that I want to point out, particularly in Des Moines Public Schools, we are a majority minority school district, which is very different than it was 20 years ago. Our demographics have changed significantly. And when we look at how Black and other marginalized students receive behavioral referrals or access to mental health services, the lack of conversations and limited discussions around equity as it relates to student needs can lead to these issues often being ignored or overlooked. About 5 years ago, we were looking more specifically at some of the disproportionate data that was readily available to help us identify and come up with action plans to speak with issues related to equity of accessing these behavioral health services. However, that review and support of that data now is not looked at in the same way that it had been during maybe the 2018-2019 school year. And one of the things that we know is what gets measured is actually what gets done. And so sometimes that could create some barriers and obstacles that might explain some of the root causes for the disparities that we see. When we talk about Iowa-specific data as it relates on disparities, we know that suspension and expulsion rates have been very disproportionate. According to a report in 2019 by the Iowa Department of Education, it revealed that Black students comprised only 6% of the student body, but represented 24% of the students suspended. This mirrors national trends, but the disparity in Iowa is particularly striking because it demonstrates how some children are punished more harshly for the same behaviors exhibited by other students. When we look at behavioral referrals, for example, a similar issue is seen in referrals when you talk about Black students and Latino students. They're more likely to be referred for subjective offenses such as defiance or disruption. These referrals often reflect implicit biases where teachers may interpret the same behavior differently depending on a person's cultural, linguistic, race, their backgrounds. Not that anybody is intentionally doing anything, but just the lack of understanding of various cultural practices, religious practices, different perspectives, attitudes, values, and beliefs. We know that our teachers and our staff could use more training and education and support to learn about the extremely ever-growing diverse population of student and families that we serve. When we think about culturally competent mental health access, we know that there is a lack of culturally competent mental health service providers within and outside of the school. With a nearly 97% white teaching and counseling workforce in a school system, and the increasing number of diverse students, we know the cultural disconnect can be quite stark. So mental health professionals and teachers often lack the cultural awareness necessary to fully understand the unique challenges, the trauma, the stressors that students face that might lead to misinterpretation of behaviors or problems rather than response to stress or trauma and what to do about it. There are structural inequities that we see too. And in a state like Iowa, for example, we know that there have been a lot of policies and procedures that have been put in place that make teachers and administrators very concerned about teaching certain aspects of our history. They don't want things to be perceived as devices or seen as promoting one group over another group. That equity has, for whatever reason, been seen as a divisive term when we know that equity has never really been achieved. So when you think about equity and equality, they're two different things, but there are groups of students and families in our state that have not yet realized those opportunities. Microaggressions, we see comments on speech and behavior, cultural insensitivity, and underestimating abilities of some of our students due to just a lack of understanding of the culture and their strengths and the gifts and talents that they're bringing. Structural inequities, again, we were talking about our state's limited funding for mental health services and providers, the lack of culturally diverse mental health leaders and also leaders in our school and in our teaching staff, inequitable funding. We know how schools are funded really looks at property taxes. And when you're in a large metro area like we're here in Des Moines, the property tax values are very different than what, if you were living in one of the suburban areas. So that can pose challenges as well. Curriculum gaps, I know that in Des Moines Public Schools that they are working with a new curriculum that is incorporating more diverse kinds of representation within the curriculum, which is helpful. But what we often find is before we can teach what it is that a student may need, we need a foundation, a good relationship where students feel safe and that they feel like they're included, they feel like they belong, that they feel connected to those educators that are providing their academic and behavioral support within the schools. So some things that we can do is not be afraid of our differences and learn from each other, grow from each other, leveraging the opportunities to speak about not just racial equity, but equity across our life continuum, whether it's in ability or disability, whether it's in language, really talking about equity as a strength and not as something that divides us, looking at providing more professional development and training on implicit bias and anti-racism training. Our teachers and staff need this. We all need this, because as we continue to get new Iowans that move into our state, there are a lot of unique ideals and cultural norms, that the standard norms that people have used to evaluate what's good or not good, what people should or should not do, has been based on one Eurocentric worldview. And we know that there are many ways and many perspectives, and they're all just as valuable as any other. We want to look at culturally competent mental health service providers, whether they are in or out of school. I can tell you that funding within the schools have really differentiated how the supportive services get allocated to support students, and there are some limitations and barriers there. Restorative justice practices are things that we have been introducing. I've seen it in Des Moines Public Schools and in other schools, which I think is a step in the right direction, looking at repairing and restoring relationships and helping to build staff capacity to always look at a teaching component through a multi-tiered systems of support that really looks at that child in the center, a whole child approach, and to diversify our teaching and leadership staff so that it is more reflective of the community that you serve. And looking at equitable disciplinary policies, bringing in community and family engagement to help support the work that we're doing. And there are a lot of initiatives that are starting to happen within our state, but I do believe that the current system and structure as we see right now, it is very difficult for students, particularly marginalized, historically marginalized students, to fully gain access to that comprehensive, seamless set of supportive services across their school experience. And I think that there are some good things that Des Moines Public Schools is working on to address some of these things, but it cannot happen in a vacuum. It cannot happen without the support of our community, our state government, our counties. Everyone has to have some skin in the game and to support the work that we're doing. And really, that should be focused on what's good for our students, because when our students are well, our families do better and our communities thrive, prosper, and grow.
Thank you. Thank you, Deborah. Perfect timing. 10 minutes on the dot. Thank you. Thank you very much for all those remarks. I can sense your passion for the work. At this time, I'd like to invite Katie Issa to please start her presentation. Katie.
Good morning. Thank you all for the opportunity to speak with you and the committee today. As I said, my name is Katie Issa. I'm a licensed clinical social worker and serve in my current role as a behavioral health services coordinator for Des Moines Public Schools. I am fairly new to this role. I started in this specific position about 6 months ago. However, prior to this role, I've served in a number of unique positions, starting at early childhood up through middle school students, serving individual students, collective, the whole school, as well as family systems. One of these roles included a family case management service, and this service focused on supporting students in the area of attendance and behavior with the goal of increasing graduation rates of students. We know in education that our work starts the moment a child begins with us, as early as 3 and 4 years old in our preschool sites. And our work doesn't end until we get them to graduation. Often when we're looking at indicators like attendance or behavior that might be impacting a student's achievement, and we start to peel away at the layers of whether it be attendance or how we're seeing a student's behavior, we find that mental health and concerns around student well-being are beneath the symptom of maybe I'm not coming to school or I'm having a hard time regulating my body at school. If we continue to peel away even further at the mental health concerns, we often find an array of barriers students and families are up against that's causing toxic stress, ongoing stress to that student, that entire family system within our community, and that's causing a long-term mental health impact. To name a couple of the barriers that we might find when we're peeling away those layers, one might be transportation. Living in Des Moines, we're grateful to have access to public transit. However, as our population has increased, Des Moines has the routes and transportation routes of services have not matched that increase. And you may or may not know, but there's even continued discussion around cutting this service. I have huge concerns on if we cut a service that so many rely on to get to work, to get to and from healthcare, what populations in our community are going to be the most impacted by that, and how will that be reflected in their mental health as students come to school? Another barrier I think of is housing and the shortages, specifically accessible affordable housing. This is a huge reality for many of our kids and families coming to school every day. I think when we say the word homeless or we think of homelessness, we may only view that as I am without shelter. When for many of our students, this might mean I have somewhere to sleep. I just may not know where that is every day. So I'm moving from home to neighbor to friend. I might see my family tonight, or we might have to split so that we each have a place to stay and be safe. And the ongoing impacts of that experience to sleep deprivation, as well as just safety and security, can have on a student. That experience alone, not including additional barriers, additional factors, causes an immense amount of stress that makes it difficult for our students to then come to school and focus and learn. Over time, that has an impact on their well-being and mental health that then we're hoping to make better when they come to school, but it certainly starts in some of those variables before they even get to school. That being said, I think it's important to note that our students and families are extremely resilient and they do continue to learn. However, I have question on how much better and how much greater could the outcomes of their future be if they weren't up against so many barriers. When I think about populations that are impacted at a greater rate around mental health are marginalized populations. Experiencing racial and ethnic discrimination in our community and the implicit bias that exists when they're engaged in school, and how that affects the workforce, how that is affecting our neighborhoods, and how our students are then experiencing trauma. Students with disability experience mental health at a higher rate, as well as LGBTQ populations and our students and families with language barriers, and how are they able to access care in a family's home language? Maybe my student speaks English, but do we have access to interpretation services for families? And many agencies are becoming creative and have technology that can help with that, but the human experience of having someone there that reflects who you are and what community you represent is a valuable piece to that treatment. And so that's another barrier. When I think about things Des Moines is doing to get creative, to meet the needs of our students, I think Des Moines has always kind of had has been able to be creative in how they're trying to allocate resources, even with those barriers, to meet the needs of our student population. My role is kind of an example of one of those. It's a fairly new role, I think, over the last 5 years. But part of this role focuses on really coordination of mental health services. And so one of the areas that I support is partnering with community mental health agencies to provide access to school-based therapy services. And the goal of that service is to address the barriers, some that I listed above or a couple moments ago, and some that Debra noted, and just that what is getting in the way of accessing services and how can we make that easier for families by providing the service at school. Some families are up against, do I miss work to ensure my student has access to therapy services or care? And if I need to do that on a weekly basis, how does that put a strain on the financial well-being of the family, on that job, if it's, paid time off isn't an option, or if missing large amounts of time creates, makes a job, maybe I don't get to continue in that job. So having that accessible at school is a support we want to continue to provide and get creative on, excuse me. But when I think about the many providers that we work with, we've probably got 54 individual providers across 64 programs, and they're ranging from 1 day a week to full-time. And if they're coming in to serve a few clients, we have to be creative in where do we find space. Space can be hard to come by. So I share that simply because we have staff who are absolutely dedicated to make this work and be flexible. So they'll even give up workspace for a couple days so that providers might come in and be able to see their students with parent consent to meet the growing mental health needs that we serve and that are in our community. And we're committed to doing that. I think that piece is just important to note because we continue to be flexible, but that also takes time and service from one job duty, meeting it somewhere else. We continue to that goes back to reallocating resources and being flexible with time in doing that. We, in addition to school-based mental health services that we will continue to coordinate, we contract with an agency to provide a student assistant program. And this is 5 free counseling sessions for any student or family that attends Des Moines Public Schools. The purpose of this service is to address any barriers to a student's school success. Most of these sessions are focused on student mental health in this past school year. So often right now, the service is often being used as almost a triage of maybe a student has been identified and expressing some suicide ideation at school, and it is not imminent threat to self, where crisis stabilization care or hospital care would be appropriate, but we really need to get into community-based treatment therapy service. And the wait list for that is 6 to 8 weeks. Our student assistance program can then be sort of that triage to meet with that student and family and work with them until a service in the community more long-term is available. But that highlights that we have students that we're maybe identifying early that are in need of additional supports, but these supports in the community have maybe decreased and are not as available. And so we're waiting. And as we're waiting for care, the mental health needs grow of that individual student, and resources to support are absolutely provided, but the need continues to grow. And I think, in closing, our district just continues to try to be creative with the resources that we do have and how to allocate those supports. But the larger question starts to become, as the mental health needs are growing, the reality is they do affect the learning, which eventually leads to greater lifelong challenges. And the earlier we can support, intervene, and provide resources equitably across our community, the better our entire community and all of our students will be.
Thank you. Thank you very much, Katie, for your remarks. Before we move into the Q&A part of the call, I'd like to remind members of the public that if you are interested in offering public comment, Following the Q&A session, please raise your hand by hovering your mouse near your name to let staff know you would like to speak. We will add you to a list and will announce your name. We will now move into the Q&A portion of the meeting. We will have a limited amount of time, so please be succinct with your responses and same to the committee. Please indicate if you have a question for a specific speaker or if directed for all the speakers. If members have additional questions, I'd like to ask you to use the raise hand function. And for members joining through the phone only, you can press *6 to raise your hands. You may also unmute yourself by pressing *6. I will now call on each committee member to see if you have a question for the panelists. Please. You can raise your hand. Mr. Donald. Bless you.
Of course, the minute I'm going to speak, I cough all of a sudden. So I have one general question. This would be potentially to both speakers, but I was trying to take notes as we were going along here too, trying to think of some of the particularly maybe more cost-effective interventions we could be thinking about that might be helpful in these situations. I was hearing some notice perhaps for training, maybe culturally competent or cultural competency training, things like that being helpful, and helping teachers also be aware where there might be something that's manifesting as behavioral issues that's tied to one of these barriers or something. So training, maybe student assistant programs. Are there other things that specifically come to mind here, also recognizing we have a lot of like rural districts and things like that where resources may be particularly tight, where there might be cost-effective interventions that you would recommend?
This is Debra. I'm going to say some of the ways that supportive services have been demonstrated in schools have changed over the years. So I personally see the need for social workers being used differently in the school models and providing more of these supportive services and interventions could prove to be very helpful. We are using a multi-tiered system of support, which I think is the right tool to use, but I'm thinking about districts that might have limited staff and staff capacity. Some of the structure in the 90s used to be social workers would be involved initially if there were attendance problems or if families needed community resources, they were connecting children and families right away to those supports. And they had a specific skill set and training to know a little bit more about trauma and stressors and anxiety than maybe some of the traditional models. So that's just one thing I wanted to add, and then I'll turn it over to Katie.
Yeah, I think, not having lived in rural Iowa to be able to speak to ways to address maybe the different barriers experienced there, I'm not sure I can say I'm an expert on that, but I do think thinking about if this is an education system mostly made up of educators, sometimes we're faced with competing initiatives around like curriculum and ensuring we're meeting achievement, but to provide training is time. And so what resources could we provide to maybe bring staff in outside of contract time and have a budget to do that, is one thought, as well as just getting creative with technology. But I do believe that takes away from that human experience. And so how can you partner with communities close by to even share a social worker or an in-person provider with those expertise to intervene earlier, teach intervention so that more staff understand that learning or that intervention and ways to support students' mental health. But and then also, how are we partnering with local colleges and universities to promote this profession and how it really ties nicely with education, because we can then have a multidisciplinary lens at the table around student safety, around education, and work collaboratively to meet their needs.
Thank you, Katie. We'll go to Stephanie and then to Alan.
Thank you both, Katie and Deborah, for your time today. Really appreciate the work you do with the students and their families, and thank you for your time today. I think you addressed one of my questions in regards to partnerships. I know working in the nonprofit or the education field, you have to get very creative. Are there other municipalities or other states that you're aware of that have different ideas that you've seen that might work for partnerships, collaborations, best practices? I know you addressed that a little bit with Donald's question. Just curious. And then you also mentioned the trauma informed, just ensuring that there's training around that as well. So I guess that was 2 questions. I'm sorry. I cheated a little bit one. And so just partnerships and as well as the curriculum that's best for folks.
I think in terms of partnerships, some larger areas, and Debra, you can jump in here as well, but I think about some have maybe one large partnership that then they're working collaboratively with that one agency or 2 agencies to meet the needs of the entire district. That seems to be more of a model in larger metro areas, where then that agency's really primary focus is contracting with the school to provide the staffing and the mental health services. Because as mental health therapy is a medical model, so it is billable and through insurance, and that's not something that as an education we're providing as the system. We're contracting to do that part, but that has some barriers when we're trying to piecemeal different agencies. So yeah, that would be one thing I would say is working in other states. And this school year, we've been able to select a curriculum that's really promoting positive skills in students that's district-wide, that we're hopeful to see some great outcomes, and there's representation of more diverse students and populations than what we've had in previous years that we're hopeful about.
And what I would say to that, there are initiatives like the multi-tiered systems of support, for example, is an evidence-based system where you are really looking at an entire integration of multidisciplinary people that come together to problem solve, to help center the strengths of that student and that student being in the center. And some of that model came out of a collaboration with public health and also education, because there were history that showed that children at high degrees of asthma were linked to like lead paints in homes and things of that nature. So public health and education had been talking at a much higher level to look at how are ways that we can better collaborate, because we're seeing the interconnectedness of how learning is affected by student well-being. I would continue to promote that from a national model for social work, school counseling, and all of those entities to really work together to look at that student in the center. And we know a lot of times it's about funding, it's about money, but everybody says it's about that student in the center. So when we can really put the funding at the level of support that that student needs at the right time, with the right providers that have all of the reputable skills to help that student, I believe that we will see growth in their academic achievement. And I want to mention something in Des Moines, and a lot of other districts are using this GLEAM model, which is grade level, engaging type of curriculum that, well, it's not really curriculum, but it is a framework for how to serve majority, well, not just majority minority students, but all students, because really we are living in a global society and an economy, and we're continuing to become more diverse as we look every year. So learning how to leverage and identify the strengths and talents of all of our students is an ongoing and continuing process of building our skill and capacity to serve in ways that maybe we have not yet even thought of, really.
Thank you, Deborah and Katie. Alan.
I had a question about collaboration, which I think was touched on sufficiently. I won't replow that ground. Thanks.
Thanks, Alan. Anybody else? Okay. Donald?
Yeah, just a follow up just in terms of thinking about trying to identify some of the issues that are being faced. To what degree would you say that some of the challenges that you are seeing are fundamentally an issue of availability of some of these type of services? And to what degree might they be issues where it's more about maybe I'd say awareness? So it could be an education piece, or it could be to the coordinator role too, as well, just the connection. So there are services there, we just aren't connecting with them well. So to what degree are we looking at it saying the services aren't there? And to what degree are we saying that we're finding a mismatch in sort of connecting with services that may exist?
Yeah, I think that it's kind of twofold. I think that the services are there, but the level of the acuity of that individual needs to be so great to access that, right? So there's a gap from that, almost that in between of I'm struggling, my mental health is impacting my day-to-day well-being and ability to thrive, but to receive more intensive care, I need to get much more sick to receive maybe inpatient or outpatient treatment, or then I'm looking at crisis stabilization, but then it's the follow-up care. And so, and are our providers then in that follow-up care equipped to meet the needs and the treatment needs of that individual, which also kind of goes back to being reflective of that community and cultural responsiveness to the needs there as well. So I don't know if I have an exact answer to say that. Is it, I think there's a bit of both. We don't have enough. And I do believe there's some matching of services. And the reality is, to navigate our current system, you may have to work with 5, 6 different individuals before you get to the care. And when we think about the time that takes, if I have all the resources and I have a support system of people I can rely on, and I have transportation and I have stable housing, I might be able to do that and get what I need. But if any one of those factors is not present, it creates a stress on that student, that system, to get to the care.
And I would say it's a bit of both too. So from the individual, the institutional, and the structural systems, there are disparities at every level. So in rural communities, they don't necessarily have the staffing capacity to have a diverse set of individuals providing a set of comprehensive services. So their challenges may be more related to coordinating and connecting to a provider that would have those capacities. They may or may not. In a system like the larger urban settings, we have them, but oftentimes they're very siloed. And when you think about the data collection process, what data do we actually collect to know what students are receiving certain types of mental health supports? Right now, that infrastructure really isn't in place to really know those sorts of variables to really provide maybe a more comprehensive support that would then be provided by that medical provider. And even a medical model, when you're talking about billing insurance, if some families don't have access to insurance, that creates some other barriers as well, and the long waiting list. And there are a host of little nuances along the way. So if we can minimize the silos and really learn how to operate in a more coordinated fashion to maximize what we have available to us to support our students, we might see student academic outcomes be better than what we're seeing now. Our trends are going the opposite direction rather than getting better off. And it's not because we're not really trying to think outside the box. We are, but there are a lot of institutional and structural barriers compounded by what the individual is experiencing.
Thank you, Debra. Stephanie?
Thank you, Chairman Ron. The question that Donald had around availability, access, and awareness was part of my piece, but I have a separate question about, so you mentioned, we see like an increase in the need for the students and their families. Are you seeing differences in the severity of issues that are being, are there more compounded, more complexity? Where you're seeing multiple diagnoses, like homelessness plus this. And so what does that look like in your arenas?
Yeah, I mean, I think definitely compounded. I think as certain programs in the community have maybe gone away or decreased, the need hasn't. And so the individual need is now becoming maybe greater because I can't access care earlier. And so maybe I'm in a needing lower level mental health care. And but because I can't access that as soon as probably we identify there being a need, that gets exacerbated. And when we're peeling away at what's going on, when that mental health or well-being of that student is being presented with a symptom, if beneath that is often homelessness, and not just homelessness, it could be an array of stressors, right? Families have protective factors and there's risk factors, and our resources to address those might be there, but we're not able to maybe get to them as soon as we need to, at the rate that we need to. And dual diagnosis certainly exists. Substance abuse along with mental health is very prevalent. And again, matching the correct treatment with that is a challenge. And so I also think about, as for an example, kind of going back to the other question as well, is we may be missing the right diagnosis because we're talking about one symptom or we're seeing the behavior. So we're saying maybe you need to go to the doctor and the doctor's talking about the behavior, but maybe there's something more medical going on, like sleep deprivation from, tonsils or asthma or different things, but we're looking at addressing the behavior versus the health. And so when Debra's talking about a system that's care coordination of all of those components, that is so helpful when you have to navigate many, many providers, because the issue might be compounded and complex, because maybe we've had to wait so long to even address it.
And that also might be very intimidating for a family to be in a room and there are all of these service providers that are there talking about a situation. So there are trust issues, sometimes there are cultural issues, sometimes there are just a lack of really understanding in just basic humanity sometimes, because the disciplines all have different focuses around what matters most to them. And so again, this whole child concept, which I think was born out of some of the movement with public education, is a concept that if you can keep that student in the center and wrap around the supports based on student needs, ideally, conceptually, then those supports should be provided based on what would it take to help this child be successful in academics and in life based on what has been identified as their need. And I think that sounds simple in concept, but the implementation and the fidelity of how that's done becomes very complex because of a lot of the other external factors that we don't control within a school creates a lot of these barriers.
Thank you. Thank you for the comments. One question, or maybe a comment and a question. With the district, in this case, Des Moines being minority majority and dealing with the different cultural nuances of depending on what country and where these families come from, the idea of a lot of times asking for help is a signal of weakness, right? I have failed as a parent. My student is needing help. I don't want to say anything, right? So now we're not addressing the problem. So that's one. And then two is I hear about telehealth, right? Obviously, not having the person in the room, it doesn't have the same impact. Any experience on that or its effectiveness, if any?
I can speak on one aspect of what Des Moines Public Schools is trying to do through establishing affinity groups so that we are beginning to learn more about different cultures, different cultural practices, different ways and opportunities that we might deliver our set of services in a way that is more cultural appropriate with cultural humility that we probably wouldn't know because historically all of the norms have been based upon a Eurocentric worldview, and we're so many countries and so many different cultures are represented in our schools, even in the rural communities. They're becoming ever more diverse as well. So really trying to learn more from our students and families and engaging them in some of the decision making and the development of policies, processes, and procedures, getting their input. We are trying to be more intentional around how do we go about gathering that information so that we learn more how we need to modify our approach and practices. So I think that is something that we've done the last couple of years. It's relatively new, and we hope to build and expand upon that and really use that as a way to bridge some understanding. Because we know you can have the best curriculum in the world, you can have the most astute provider, but without a relationship, without trust, without really understanding how to leverage a person's culture as an enabler for, they're the expert on their student. We're here to support that. Really knowing how to identify that, I think that we are continuously learning how to do that with integrity and fidelity.
And I would just add to that we have bilingual family liaisons that I also think are a key role throughout our schools that do not probably get recognized enough. And we certainly don't have enough of them, of this role. They do far more than just provide interpretation services to our students and families. And I have found that they have been a key factor in supporting a family through what are the cultural norms in that community and in that family system, and how are we talking about that, and then sharing potential opportunities to access treatment, because asking for help is seen as a weakness, or talking about mental health is also really seen as a negative. I could be isolated from my community if that's something that's going on with that I'm talking openly about. So our bilingual family liaisons are a wonderful resource in teaching those that are not reflective of the students that we're serving and what cultural norms that we need to do better about, but also then how can we bridge and support where a family is at and connect them when they are ready or want that support. So that's one aspect, but we can always be improving and doing better, and looking at how can our mental health providers also be reflective and consider the strengths of that community and looking at the needs of that student from different lenses.
And he mentioned, you asked a question about telehealth, and I know NASW has been looking for ways to open up opportunities for more providers to be able to provide telehealth services. And while it is not the same as being in person with someone, sometimes communities say, I don't really want someone that lives in my community that I know. I might feel more comfortable talking to somebody that isn't necessarily in my community. So I know NASW has been looking at ways to provide opportunities so that providers can cross state lines and be able to provide mental health services via telehealth. So that's something that I know is being talked about, and some movement is happening to open that up.
I have seen that happening in other states. One of the issues that comes with that is access to high-speed internet. If you happen to be in a rural part of any state, how do you access that? And then is it happens during the school day? Does it happen in the school setting, or does it have to happen at home? Then at home we have more challenges, and also the fact that many families yet today don't have a computer at home, and this is the only computer they have.
Right.
So,
and I can add to, we are looking as a district or have a partnership with a larger organization and going to take working on getting telehealth available to all students, and then taking some data on what the outcome of that might look like for many of the reasons, Debra, you mentioned, but also the idea that we just don't have enough providers, and it would also help with access. So we are looking at that. Again, the challenge with that is legislation states that, you know, we have to have an initiator to that session, someone to start it, someone to stop it in a confidential space, but also within eyesight of that student. And so I go back to thinking about staffing, right? How do we get creative with the resources we have to ensure that we're providing that service because it's available, but how do we ensure that student is safe and that we're also following guidance from legislation to do that with fidelity? So that is something that's being discussed and that we're working on, but noting that that is some of the things we need to problem solve around as well.
Thank you, Katie. I can remember what school leader I was talking to. This was out of state. He mentioned that they were using for telehealth therapists from Argentina. Somehow their certification was validated to, as a level of service that is approved in the US. So they had access to those therapists from Argentina to help with their students after hours. So anyway, that just came to mind. Any other committee members that have a question for our panelists? Thank you, thank you. This is a rich conversation, and I think we can be here for hours talking about this. So let's move over to, make sure here, move over to the public comment part of the meeting. We will now go into public comment. This is an opportunity for the public to offer comments to the committee about this topic. Please keep your comments limited to 4 minutes. If you would like to make a comment, please raise your hand. If you're joining by phone, you can press *9 to raise your hand. Please also note that you may submit written comments by email to mtracenberg@usccr.gov. Mallory, do we have any members of the public join us?
No, I don't see any members of the public have joined at this time.
Well, this will be a quick meeting then. Any other questions, any other comments from committee members or even our panelists? Okay, well, before I say my closing remarks, I just want to say, Debra, Katie, thank you. Thank you for everything that you do, my friends, and thank you for taking the time to join the committee today. We appreciate your engagement, and we'll keep your comments in mind as we draft our report. For everybody else, thank you for joining us. We appreciate your time and look forward to having you join our next few web hearings. The Iowa Advisory Committee members, please stay on for our business meeting. Everyone else, feel free to stay or to join the business meeting. Otherwise, please enjoy the rest of your day, and thank you for everything you do.
Thank you all so much.
Thanks, Katie. Thanks, Debra. Anyone else, Mallory?
I don't see that anybody else has joined at this time, but we do have 1, 2, 3, 4, 5 members present still. So we do have quorum to make decisions for the business meeting.
I'm glad we got this done in an hour. This is awesome. So thanks, everybody.
Chairman Wall, would you like me to share the slides for the business meeting portion at this time? Would that be all right with you?
Yes.
Great. And while I do that, a quick introduction. Hi, everyone. It's very nice to meet you. I'm in Anna's role. Anna's still here, but our boss was shifting around committees. I had a few committees expire in June. So to ease the workload for Anna, he shifted some of hers around.
Perfect.
Okay.
Beautiful. I was just looking at, and I know that Donald has to go in about 5 minutes, so we'll make this quick. Review the project timeline. Are we on track, Mallory? I think we are, aren't we?
Yes, you are. So very generally, and you've likely seen this already with Anna, but your term expires in July 22, end of July 2025. So you'll see kind of at the end of this slide where your term expires, and we try to count back from your term expiration to make sure we can get a report drafted, deliberated on by the committee, and then sent to publication before the term expiration. So you all are on time. What we're likely planning on doing is completing the record today in terms of having additional briefings, at least from what I heard from Anna. This was, a perspective that you were hoping to hear from. One of the gaps in testimony that I was informed about was the student perspective. And so one idea for getting that perspective, and Donald, it'd be great to hear from you before you have to leave if possible, is potentially just creating a 2 to 3 question poll that we could share with all of the panelists who have access to student listservs, and try to have them share that poll with their students, just with a couple of questions that you all think of, and have a turnaround of perhaps 2 weeks, and then include their perspectives that way. I didn't get the sense that we'd be able to have a live briefing that would actually fit with their schedules. Debra worked really hard to make this meeting happen today. And in talking to her and hearing about the school schedules, it just sounded like that probably wouldn't actually get a lot of student participation. So that was pretty much my question for you all. And I'm going to take my screen down. Again, I know you have to leave, Donald, but is there an interest from the committee in actually developing a poll? I haven't done this before with a student population. We've done it, it's part of our standard procedure for collecting written testimony for anybody who can't join a briefing. But if so, then I would just be curious what questions you all would like to include. And just keeping it short, this is students. So what are the main pressing things that you would have hoped to hear in a briefing? I'll just open it up to anyone who can chime in.
I guess the first question is based on what we have heard so far on the different briefings. We want to do this, correct or not? I
Absolutely.
think hearing the perspective from the student, the people impacted, I think is powerful.
Yeah, I think there's a strength even if of the concern to hear the student perspective. You have the opportunity, if you're doing a poll, to potentially anonymize the feedback that you'd be getting if there was something that's open-ended on it, that way it would actually alleviate some of the concern from having a student have to come in and testify, that we might be able to get some, if there's one open-ended question or something, have some anonymized feedback that would give us some sense of the student expression of what the issue looks like.
From a legal standpoint, since we're reaching out to people at K-12, chances are, under 18, anything that we have to cover there before we do this?
We've looked into this before with other briefings that we've held, and we haven't seen issues there. We just try to provide an informed consent for this kind of a thing. With it being a poll and we having control, I would probably just not include last names as a starting point. And if you all would prefer just fully anonymized, that's also okay. So we have a lot of latitude for what we can create, but I agree, Donald. I do think this would be very helpful also for students to be able to think about what they would want to share, and then not kind of have that come up during a meeting where they want to retract it, because we're not able to retract these live recordings. So I think it hits a few boxes there.
No, sounds
I would
good.
prefer fully anonymized.
Yeah.
Fully? Great.
We'll just call them, if we get responses, student 1, student 2, student 3.
Excellent.
I like that even better, just to make sure that we're covered and also that we get that true feedback from them.
I think it's also important that we do capture demographics as much as possible. If we're talking about, access and marginalized populations, comparison of, rural versus urban versus LGBT versus not. I think we need to be able to disaggregate that data because we need to know the bigger picture.
Yeah. Will we have access to that data before?
This would be voluntary checkboxes that they could choose to select or not select if you would like. I mean, this is literally just a poll I could create for you all on SurveyMonkey most likely, or Monday.com. We use those platforms a lot.
Okay. Now, what kind of questions are we asking? Since we're all together, might as well decide the questions so that we don't have to wait until the next meeting.
I do wonder if we're going to just one thing as far as format for it. Given the ranges of ages we'd be looking at, I mean, a high schooler might be maybe willing to answer a survey or something like that. I have a 6th grader. I can't imagine her doing that or ever getting an email where she necessarily would. So I wonder more if some of the more effective partners we might find would be where we have connections to school administrators or something like that we could get. For some of these areas, we might be able to get demographic information for their school. And if they would be willing to have, put it out to some students or have a class or two of theirs as part of their keyboard class or something, just do a quick survey or something like that. If we find partners that way, then we can keep it anonymized. We can actually get some decent demographic data for the whole group, just based on what the demographic of the participating schools are, while keeping it, anonymized there. And it might let us be shorter on some of those too, because I do very much agree. The younger you go, especially, you really want it to be very clear questions and pretty short.
Yes.
I'll flag for you that, and I can't tell you what the rule is in detail, but I think there's some restrictions on ability of teachers and school administrators to do survey instruments without parental consent. And so I think I think Donald's idea is sound. However, I think there's going to be a barrier to getting that data back and through that pipeline.
I was just thinking the same thing, because I know we got an email from our school district last week asking for consent for a survey of some sort for our kids, and we have to log in and grant the consent. So I think that probably is a restriction we need to work around.
But I know in past folks that work with agencies that work with the students, like Big Brothers Big Sisters or where those restrictions might not be as tight. So that might be another workaround to work with the agencies that work with the students to help administer the survey, because that's a really good point, Alan. Absolutely.
And it doesn't have to be a survey. This is just one kind of idea to try to get some input. But yeah, these are great points.
So do we want to start thinking about the questions, or what do we think?
That would be helpful just in terms of looking at your timeline. I know I only put it up briefly, but we would want to start writing the report this fall. So shortly after we get the transcript for this briefing, we'll share it with you. And my sense was if we were to do a poll, we would try to share it with all of the panelists who have participated. They at least know who you are and what you're doing and could help you point people for questions like, who is this group, for example. You know, my information would be included as well, but having that connection can be really helpful in building trust. But of course, the parental consent is a really good point. We would need to probably have you all be reviewing a draft and voting on a draft in the winter, early spring, in order to get something, make sure it gets all the way through publication. You're in a good spot to make it through, but we like to plan ahead to make sure there aren't like 10 reports going through legal sufficiency review at the same time, because it's a staff of 3 or 4 people, and so things can just take a little bit longer if they all happen at the same time.
I think one of the questions would be, you know, access. You know, are you aware, or does your school or have you looked for mental health services, or do you know where to go? I mean, somebody can make this prettier than me, but do you know where to go to get services, type of thing, right? Are you just to get the awareness? Do they know? One, that that's available, and 2, if so, do they know where to go?
Yeah, my thoughts were, and I'm gonna have to run here, but basically, one, I think you're nailing exactly what I was thinking too. If the question around a lot of this is going to be access, it's going to be if you needed the services, and we're going to figure out how to word it too, because mental health service or something like it'd be more of a, if you're having a problem, and I don't know how to exactly frame what type of ones we're thinking about, would you know who to go to? And then there's going to be something about, you know, maybe even would you feel comfortable going to them? I think that gets to that, some of that. So do you know who to go to? Would you be comfortable? Might get to some of the disparate availability concerns that we have. And then maybe an open-ended one might be, you know, have you used these services have you used service like this in the past? And you know, what was good about the experience or bad about their, I don't know exactly how open-ended or how you'd phrase that side, but that would be where you might want comments from people that are, or there could just be an other, I guess, as I'm talking out loud. If they have any comments to share, so that it's not required that way. But it could seem to me access on one hand, do you know where to go? Would you on that hand? And then if maybe something to the degree of if you have in the past, if they've been good.
And if they wouldn't go, why not? I mean,
yeah,
you know, kind of to your point.
What's preventing you from?
Yeah, what is the stopping point? Is it access, transportation, etc.?
Mm-hmm. And I'll need to run now, so.
Thanks, Sano. Send us an email if you think of more questions, my friend. You're pretty good at this. Something like, kind of like, you know, asking for a friend type of thing. Do you have a friend, or do you know someone who has received services, experiencing issues or whatever? You know what I'm going with this on, just to see as the person, you know, how open are they, students talking about it amongst themselves, whether they're looking for services or not, right? Because, I mean, as a student, somebody might say, yeah, I know someone who, you know, talks about these things, but A, they have asked for services, or B, they don't want any services, right? Yes, I don't know how to frame that. But yes, again, to check on the awareness of how aware are these students of others who are experiencing issues. And I think we want to keep it short, right? 2 or 3 questions. How many do we have now, Mallory?
Well, that's 5 unless you loop that last question into a general kind of statement for each of them of do you or does someone you know need this service. And I think you all recognize this is really just to try to fill a gap of student perspective. This is not going to be rigorous. There's going to be selection bias, all of that, a lot of caveats here. But that's what we get for public comment as well. And I would say that the folks who probably are going to be able to reply, they're probably already going to be connected in some way. That's how they're going to hear about this surveys. They're going to hear from some kind of service provider in some way. So, a big grain of salt. I do think it's helpful. And if anybody else has another idea, welcome to raise that as well. But I raised this with Debra and Katie, and I think they said they'd be open to sharing something like this with their students if it's possible. Yeah.
Yeah, I think it's valuable. Nobody should say, add the word scientific to this to this survey instrument. But I think it's just it's a fancier version of the old-fashioned journalism school man on the street interview. You walk up to somebody, what are people thinking in your community? Well, it's not public polling, but it adds a little color to what we're writing, and I think will be helpful. So,
All right. Anything else?
Not here.
You guys might have even time for lunch because I'm getting hungry.
The Potbelly sub man is coming any second, so we either have to adjourn or you're going to watch me eat. So
same here.
I have another quick process question for you all. It's been some time since you've written a report together, right? Has it been about 1.5 years at this point?
1.5 years or a year?
It may have just been a year.
Yeah.
So yeah, just a reminder, I follow a process very similar to Anna's. We'll work on sharing the transcripts with you all. We'll work on getting kind of a summary of the major points that we see, and we'll offer it to you all for comment. But essentially, we want it to be your report. And so we're going to be looking for any edits, additions, anything we missed, anything that you want to word differently or highlight differently, emphasize differently, for example. And then after you go through the votes of looking at the findings section and then developing recommendations together, the report does need to go through legal sufficiency review. And so that's what I was saying is a little bit outside of our hands, can take some months. And then, we'll work towards either having another meeting following the legal sufficiency review. That review is really just checking our citations, usually looking to make sure that we're citing any legal citation appropriately. Every other point that we're making in the report usually cites to your transcripts from the briefings. So we'll likely have time for a post-report type of activity. That could be however you want to raise awareness of the report. We'll build that into the timeline, but that's also the buffer zone. So for example, if we're running up against the end of your term, then you ideally should have the link to the report published and all of that to share with your networks. But are there any questions about the report writing process that you might have at this point in time before we kind of shift gears into that?
No.
I think we're good. Perfect.
Great. So I will also share the slides from today's meeting. I know I put up the timeline very briefly. I wanted to make sure we had Donald perspectives on the student perspective questions, but yes, very briefly, that timeline really should be able to get you to publication before the end of your term. And we're always here for questions. Corinne is still here. I know she's been with you the entire time, so that's great. And we will also need to be setting up a poll for your future meetings. So since you're all present right now, we're likely looking at Tuesdays or Thursdays. Is there a day that's generally bad for anybody who's currently present?
We were doing Thursdays in the afternoon, right? Because I think today, and the issue that we have with Donald as well, having class during the day. But I think this was the only day that worked, or I don't know why we landed on
Debra. Yeah, this was the one day Debra could do it. Yeah.
And I appreciate that. So I think, and also thank you to the flexibility of the team members here. But Yeah, I think later in the afternoon, Adam and Stephanie, any preference, or do we want to kind of stick with like that Thursday, 3:30 Central?
So mornings are a little tough in my arena as well. Afternoons.
Or even during lunch, I guess, if we don't mind.
Yeah, mornings
After.
just tougher.
Yeah,
Yeah.
Thursday afternoons generally are better for me.
Same.
Great. Okay. So yeah, we be on the lookout for a poll for your availability. And would you like me to send the draft survey questions to the entire committee and get anybody else kind of weighing in? I know the committee is a little bit larger than we had today, so. Okay.
Yes, please. Thank you.
All right. So yeah, give me a couple of days to kind of gather some of these different thoughts and see what we can put together, and then we'll follow up. And as always, we're available for any questions. So thank you all for
Thank
joining.
you, Mallory. Thank you,
Thank you, Mallory.
for always being there and keeping us straight with everything working. And Sarah, too, behind the scenes.
Oh, yes. Sarah was here.
Stephanie, Adam, Alan, good to see you, my friends. And I call the meeting adjourned until the next time.
Sounds
Thank you,
good. Thanks,
everybody.
team.
Thank you.
Take care,
Thanks, everybody. We'll see you. Bye-bye.
Bye-bye.
Thank you all.
Okay, Mallory.
All right. You all set?